Hey everyone, ready for a deep dive? We're tackling ChatGPT for family physicians today.
Specifically.
Yeah, specifically whether the free version is good enough or if we should be considering that paid version.
That's a great question a lot of folks are asking.
Definitely. And luckily, we've got Dr. Kamlesh Bhargava's guide.
Oh, yeah, he lays it all out.
So let's get right to it. He starts with the training data.
Uh-huh.
I know AI and data are like two peas in a pod, but just to remind me, why is that so important?
Well, think of the training data like the foundation of what ChatGPT knows. The free one,
That's using GPT 3.5, right?
right, only goes up to January 2022.
Okay.
But the paid version,
GPT-4.
GPT-4, has info all the way to April 2023.
Huh. So it's like over a year difference.
Yeah, and that might not seem like a lot, but in medicine, things change fast.
That's true. New research comes out all the time.
Guidelines change, heck, sometimes whole new conditions pop up.
So if I'm using the free version, how far behind am I really?
Let's say a new diabetes drug got approved, February 2023. Free version, nada. Paid version, it's got the info.
Interesting.
And it's not just these new stuff, it's also got the updated best practices.
Oh, so what we should be doing now.
Exactly.
So staying current is a big deal then.
Huge GE. And on top of that, there's web browsing.
Uh-huh. So we can look things up, LE.
Only the paid version. Yep. Accesses info straight from the internet.
Wow. So it's like having the latest medical journal constantly
His
updated.
textbook from a few years back, yeah.
What kind of advantage does that give you in a clinic?
Let's say rare skin condition walks in. Boom. Pull up research, treatment options, even specialist directories right there.
While you're with the paid.
With the paid version, absolutely. Free version, you're stuck with what it already knows, which might not be enough.
I can see how that'd be a game changer, especially with tough cases.
Hmm.
So we got the data cutoff, we got the live web browsing. What else?
Well, the guide points out GPT-4, that's the brains of the paid version.
Right.
It's just more sophisticated, Especially with complex medical stuff, it understands the nuance better.
So it's not just about how MUCH data, but how it uses it.
Exactly.
So does that mean the free version is unreliable?
Not at all. For basic stuff, it's great. But when things get complicated,
You want the specialist, not the GP.
perfect analogy.
Yep.
The paid version can handle those little details, the what ifs, the thing a simpler model might miss.
Makes sense. Okay, now picture this. I'm in the clinic, swamped, patients everywhere.
I know that feeling.
Does the paid version help with the speed, like getting answers faster?
Dr. Bhargava says faster response times, guaranteed access, so you're not waiting around.
That's crucial when you have a waiting room full of people.
No one wants to be staring at a loading screen when there's work to be done.
Exactly. Anything else tempting about the paid version?
Oh, one more thing. It's got this thing called DALL-E 3.
DALL-E 3. What's that?
It's an AI image generator. You can make visuals right there in ChatGPT.
Hold on, I can make pictures. Like what kind of pictures?
Anything. Anatomical diagrams, stuff to help explain things to patients visually.
Oh, wow. So instead of trying to describe what a herniated disc looks like,
You could just make a picture.
that's incredible. Are there limits to what you can create with it?
There are some guidelines, but the possibilities are pretty wide open.
That's amazing. I'm already thinking of ways to use that for patient education.
It's a great tool for that, really personalizes things.
Yeah, instead of using generic diagrams,
You can make something specific for that patient, their needs, their understanding.
there's like a custom-made medical textbook for each person
You got it.
that could really help them understand what's going on.
Absolutely. It makes it much easier to grasp those complex topics.
So we've got more up-to-date data, we've got real-time web browsing, we've got a more advanced AI with GPT-4, we've got faster responses, and we even got this amazing image generation tool.
It's quite a package.
It really is.
Yeah.
But even with all this fancy stuff, we can't just take what the AI says as gospel, right?
Dr. Bhargava really stresses that. It's a tool, it helps us, but it doesn't replace our judgment.
Right. We still need to think for ourselves.
Exactly. We use our knowledge, our experience to make the best decisions.
So it's a partnership, not a replacement.
I like that. ChatGPT can give us information, help us explore options, even challenge us.
But we're still the doctors.
We make the final call.
Makes sense. So it's about finding that balance, right?
Yes, using the power of AI, but staying true to what we know.
And to good patient care.
Absolutely. It's a new way of doing things, exciting, but we got to stay grounded.
Grounded in our values, our ethics.
Right. And speaking of ethics, there's another point Dr. Bhargava brings up.
Oh.
Data privacy, security, all that.
Oh, of course. With all this AI and data flying around, it's easy to forget about that.
Exactly. He says, read those privacy policies carefully. for both versions.
Makes sense.
And think about what we're putting into the system,
Yeah, be careful what you share.
just like with anything else online.
This has been super helpful. We've covered so much already.
And we're just getting started.
I know, right? From the practical differences to ethics to all the possibilities.
And there's still so much more to explore.
It's a little overwhelming, but exciting too.
It is. And like Dr. Bhargava says, we need that balance of excitement and caution.
Embrace the potential, but be aware of the challenges.
Exactly. So for anyone who's ready to try ChatGPT out,
What do they do?
well, Dr. Bhargava's guide has some great advice. Try both versions. See what fits your style.
And don't forget those privacy policies.
Absolutely. And most importantly, stay curious, keep learning,
And talk to your colleagues about this stuff.
share your experiences, figure it out together.
It's definitely a conversation that needs to be happening.
It really is. AI is here to stay. Might as well learn how to use it responsibly.
For the benefit of our patients and the future of healthcare.
Couldn't have said it better
That
myself.
makes it so much easier to understand,
Yeah.
right? I mean, visuals are powerful.
Oh, absolutely. And it's not just for patients.
Hmm.
Dr. Bhargava also talks about how it can help us, the doctors.
Like with continuing education and stuff.
Exactly. Imagine, need to refresh on the latest guidelines for something?
Right.
Bam, ChatGPT can give you the rundown.
Like having a pocket expert.
Or, say you've got a tough case, you want to bounce ideas around.
Get a second opinion?
ChatGPT can offer different perspectives, things you might not have thought of.
That's amazing. 24/7 access to like a whole team of consultants.
Pretty much. And it can even help with the boring stuff.
Oh, please tell me it can do my paperwork.
Well, not do it, but it can help.
Okay, I'll take it.
Draft referral letters, summarize patient notes, things like that.
Anything to save time.
Exactly. Free up more time for the patients, right?
That's the goal. This is incredible. We've gone from data and features to ethics, and now even how it can help us learn.
It's a lot, I know.
But it feels like we're just scratching the surface of what AI can do in healthcare.
Oh, definitely. This is just the beginning.
And like Dr. Bhargava says, gotta approach it carefully.
Right, with both excitement and caution.
So for anyone who's ready to take the plunge, try out ChatGPT.
What's the first step?
What does Dr. Bhargava recommend?
He says experiment. Try the free version, try the paid version.
See what works best for you.
Exactly. And of course, double check those privacy policies.
Always. Can't forget about patient data.
Absolutely not. And above all, stay curious.
Keep learning, keep talking about it.
With your colleagues, with anyone who's interested.
It's a conversation we need to be having.
As a profession, for sure.
Because AI is here to stay, right?
It is, so we might as well learn how to use it wisely.
For the good of our patients and for the future of medicine.
Exactly. It's an amazing tool with the potential to really make a difference.
It really is. So how does Dr. Bhargava actually see us using ChatGPT day to day?
Well, one thing he talks about is patient education.
Okay.
Like, imagine you could whip up these personalized explanations, tailored to how that patient understands things.
Oh, that'd be so helpful.
Right, like instead of me drawing diagrams or trying to find simple explanations online.
I know. Sometimes you feel like you're back in art school.
Exactly. ChatGPT can actually create stuff that takes into account their age, education, even cultural background.
Oh, wow. So it's like a medical textbook made just for them.
Pretty much. And when they really get it, that's when they're going to be engaged.
That's so true. Understanding is key.
And it's not just, Jesse, for patients.
Oh, someone else can benefit.
Doctors. ChatGPT can help with our education too.
Like how to keep up with all the latest stuff.
Yep. Need to brush up on some guidelines. ChatGPT's got you.
Like a study buddy.
Or a tricky case. You need some fresh perspectives.
Yeah, those are the ones that keep you up at night.
ChatGPT can help you think outside the box.
It's like having a whole team of experts on call.
Available 24/7.
That's pretty amazing.
It really is. And think about this. It could even streamline administrative tasks.
Now you're talking my language.
Like help with referral letters, summarizing notes.
Anything to reduce the paperwork pile.
Exactly. Free up that brain space for what matters, the patients.
This is mind-blowing. We've covered so much, from the basics of free versus paid.
To ethics, to how it can actually help us be better doctors.
And it feels like we're just getting started with AI in healthcare.
Oh, this is just the tip of the iceberg.
A little scary, but mostly exciting.
Definitely exciting. But Dr. Bhargava is right. We got to be smart about it.
That balance of, enthusiasm and caution.
Yep. Embrace the potential, but be aware of the pitfalls.
So for all the family docs out there, ready to give ChatGPT a shot,
What's the next step?
what's Dr. Bhargava's advice?
He says, simple, experiment. Try both versions.
See what feels right for you, for your practice.
And of course, read those privacy policies.
Got to protect our patients.
Absolutely. And most importantly, stay curious. This is just the start.
Keep learning, keep talking, figure out how to use this incredible tool the right way.
For the benefit of our patients, for the future of medicine.
Well said. As our deep dive into ChatGPT for family physicians.
Hope everyone learned something new.
And got inspired to explore this amazing technology.
Because who knows what the future holds. It's going to be an exciting ride.
That's for sure. Thanks for joining us, everyone. And until next time, keep those brains buzzing about tech.